Dr. Poulome Mukherjee. I'm a surgical oncologist working in Cohort Cancer Hospital and Research Center, Silchar, Assam. My project is an extension of my personal journey and evolution with the WomenLift Health team. I owe all my peers, mentors, and coaches for helping me and supporting me to convert my vision into reality. Cohort Cancer Center is a 100-bedded cancer care facility in Silchar, Assam. We cater largely to a rural population residing in the Barak Valley. We see 30,000 follow-up cases and 50,000 new cases of cancer every year. The incidence of cancer is on the rise, and our end of the world is no different. Obesity is a well-established risk factor contributing to the incidence of many common cancers, including breast, colorectal, uterine, and ovarian cancers. It's also linked to an increased risk of cancer recurrence and mortality. Our hospitals show that 55% of women with breast, ovary, endometrial, colon cancers are obese. Obesity, inactivity, poor dietary quality are all linked to decreased overall and cancer-specific survival. Physical activity, consumption of healthy diet have clear benefits to the physical and the psychosocial health of cancer survivors. Studies have demonstrated that interventions targeting weight, diet, physical activity are feasible and can improve the quality of life. They also minimize the disease and treatment-related side effects for cancer survivors. There are clinical lifestyle recommendations from all over the world, including India. Yet, no surveillance program in the country integrates diet and lifestyle interventions aimed at helping people attain healthy weight and endorse lifestyle practices in line with rehabilitation. I started my journey in March 2023 with the WomenLift Health team. With the help of my mentors, coaches, and guide, my vision was transformed into a project. Impact of nutrition and physical activity intervention on health behaviors of women cancer survivors in a semi-urban cancer hospital of India. As a part of the study, we would follow 100 women cancer survivors with a BMI of more than 25 for a period of 12 months. The team, consisting of oncologists, medical social worker, dietitian, and physiotherapy, would counsel the patients and administer KAP questionnaires. They would then prescribe a diet exercise program based on feasibility, affordability, and patient preferences. The target would be to achieve the weight or the BMI determined at the start of the intervention. We would also follow up their quality of life scores and fatigue scores during the study. There will be a pre and post KAP questionnaires. While this was all good on paper, my biggest challenge was to get down to a study involving nutritional sciences and exercise physiology, which was very different from my own specialty. Sessions on inclusive leadership helped me tremendously to strengthen my network, and I hence reached out to an obesity specialist practicing in the US. Both our teams collaborated completely pro bono and put down a dietary intervention protocol based on ICMR guidelines, an exercise intervention protocol based on the Australian, the American, as well as the ICMR guidelines, and the European Quality of Life and Fatigue Scales Incorporated, a knowledge, attitude, and practice questionnaire from India, which was completely validated. Phase 1 of the project involved a month-long training of the entire team to familiarize ourselves with the different parts of the protocol. Phase 2, which was implemented recently this year, involved recruitment of patients, scheduled visits, weekly phone calls, and maintenance of food and exercise log. An expanded version was submitted for the ICMR for grants. While it is very early to look at the results, I would like to share a small snapshot of what we have as a team set out to achieve. She is a young ovarian cancer survivor who had opted for a gym-based exercise regimen along with a dietary intervention. This project is the beginning of a major milestone in women's empowerment. I thank my entire team for this life-changing journey. Thank you very much. I will be happy to take all your questions.